Welcome. I'm Leslie Canham.
I'm Mary Gavoni.
I'm Linda Harvey.
I'm Olivia Wan, and together we are the Compliance Divas.
Hello, my name is Leslie Canham, and welcome to the Compliance Divas podcast. We bring clarity and simplicity to compliance by navigating regulatory compliance to keep you on course. Subscribe to the Compliance Divas podcast through your favorite podcast channel or on our website, thecompliancedivas.com. Any resources that we mention today on our podcast can be found on the show notes, or you can go to the compliancedivas.com website, click on the episodes, and scroll down to the show notes. You can also submit your questions to support@thecompliancedivas.com. I'm super excited today for our podcast on a new standard in eye safety for dental professionals. We have with us today a special guest, Dr. Peter Arsenault, who is a professor and the head of operative dentistry at Tufts University School of Dental Medicine. He has a background in plastics engineering and dentistry, and he holds multiple patents and is a fellow of the National Academy of Inventors. He's a leader in clinical practice, education, product innovation, and he blends expertise in dentistry, engineering, and business to advance the field and mentor future professionals. Dr. Arsenault has spoken at a group that I belong to. Everyone that has listened to our podcast in the past has heard of OSAP, the Organization for Safety, Asepsis, and Prevention. Now it's known as the Association for Dental Safety. And he had an amazing presentation on eye safety. It was very eye-opening for me, to say the least. I've seen him a couple of times present his information, and I really like to just let him take over from here and just tell us about his experience with eye safety and an injury to his eye. Could you just tell us a little bit about your experiences, Dr. Arsenault?
Sure. Thank you, Leslie, for the kind introduction and warm words, and thank you, everybody, for having me. So I became sort of interested in eye safety and dentistry by accident, actually, and how it all came about was one day I was practicing in my practice, and I believe I was removing an old sort of defective amalgam restoration, and that's a silver filling. And in the process of removing it, I was wearing, just to paint the picture, all the appropriate personal protective equipment. So I was wearing a OSHA standard safety glasses that were compliant with the Z87.1 standard. I was wearing a mask, a surgical mask, and everything, and the side shields, et cetera. And in the process of removing this filling, if you will, a chunk of it flew out and hit me in the eye somehow. And I ended up that afternoon in the emergency room. And it was a harrowing experience, no long-term effects, thank God, but I walked away with a patch on my eye and antibiotic drops and a few things. And it was eye-opening. Haha. But so that was it. And it kind of just, glad it was over with type of thing. And you know what? It was probably a couple of months later, I was adjusting something in someone's mouth and I was feeling stuff hit my eye. And I had my eye protection on and I had everything on. I was like, what is going on here? So kind of long story short, I did some serious thinking because I said, gosh, this is a problem. And started investigating and looking into it and did some modeling, if you will, where I took mannequins and I based the mannequin to be sort of in a position of the dental healthcare provider and did what was called spray studies, where we sprayed towards the face a dye. And lo and behold, what that spray study found was that the safety glasses protected you from perpendicular trajectories. The side shields protected you from side trajectories, but there was this unaddressed space called bottom gaps. And that's the big word of the day. And bottom gaps are that space between the lower rim of one's eyewear and the cheekbone or the top edge of the mask. And we found that's where all the debris is entering. So the research was published And it garnered great interest in the personal protective equipment and safety world in dentistry and healthcare. And, we spoke a little bit about it and toured a bit and brought some awareness. And in the research phase, we found that 70% of all dentists and healthcare providers receive some degree of ocular trauma in the course of their careers. And we found and narrowed that it's mostly through bottom gap exposure. So this was pretty, groundbreaking what we found. And one day I got a call from NIOSH, the National Institute of Health and Occupational Safety, and they were very interested in the research and publications, and they asked if they could sort of duplicate it at a much higher, more sophisticated level. And they did it in their labs. And actually, the gentleman conducting the research used that as his PhD thesis, and he got his PhD with that. So anyway, it started really taking a lot of traction. And I started lecturing around about eye safety and dentistry. And this, lo and behold, this thing called bottom gaps. And NIOSH from there actually found that there was a huge shortcoming in bottom gap exposures. And as a result, we consulted, we worked together, and we developed a new safety standard, which came out in 2022, that addresses bottom gaps. And that's a new ANSI standard. It's called Z87.62. And that particular standard, it's the American National Standard for Occupational and Educational Eye and Face Protection Devices for preventing exposures caused by sprays or spurts of blood or bodily fluids. So there's, up to that point, there's been no standard of care to protect bottom gaps against biological hazards. And so that's the standard that came out actually end of 21, but it pretty much hit the market in 22.
That is amazing information, Dr. Arsenault. Our diva Linda had a couple of questions for you.
Thank you, Leslie. Dr. Arsenault, we're so happy to have you here. I've been following your work, and we all know how delicate our eyes, what a delicate part of the body the eye is. And it's unlike some other part, where a finger or hand, we might get a cut and the body's going to heal itself. For the eye, you only have two eyes and you don't have a chance to have another eye. So it's so very important to your research. And we're so glad that your vision is fine as a result of your incident. But there's one other organization, and that's OSHA, that says what we should wear for eye safety too and face protection. Could you address how ANSI and OSHA come together and what should we currently be doing and recommending to our clients?
Sure. So OSHA is sort of like the governing body, if you will. And the way OSHA, and we presented all this information to OSHA. We went actually to Washington, D.C. and presented. And so what OSHA told us was that OSHA standards incorporate a particular reference from ANSI. And so ANSI is the body that sort of makes the standard, and OSHA will enforce it. So the standard that addresses eye safety that OSHA follows is standard number 1910.133. And that's the particular standard that OSHA looks at. And so as technology evolves and improvements are made, OSHA sort of morphs and follows those improvements. And so it's very cumbersome for OSHA to keep rewriting their standards. So what they do is incorporate initial language in their standard that allows their standard, and in this one particular 1910.133, to evolve with the times. So for example, the way the standard is written, it says that the employer shall ensure, and I'm quoting, that each affected employee uses appropriate, and they highlight the word appropriate, eye or face protection when exposed to eye or face hazards from flying particles, molten metal, liquid chemicals, acids or caustic liquids, chemical gases or vapors, or potentially injurious light radiation. The key word to remember is OSHA uses the word appropriate. And so as standards evolve, technology improves, we discover more, like we did with this research. This research is now covered under what's now inappropriate. And because the research has been vetted, it's been published in peer-reviewed journals, It's been presented at academic levels. It's now, and ANSI has created a new standard. This is now the next level of appropriate eye care. So essentially, anybody or any employer who does not offer bottom gap protection could be liable. And if an employee is injured. So one of the lectures that I was traveling around giving was called Eye Safety in Dentistry and Associated Liability. And so the goal of that lecture was to discuss the new and improved standards and all the findings, and to sort of give the listener an awareness of what's now appropriate so that they wouldn't be stuck in a liable situation if one of their employees were to be injured.
Thank you so much for that insightful information because, it changes and trying to help offices stay abreast of that information. And I think you nailed it when you said the next level of eye safety. And certainly, dentist, hygienist, all the practitioners always looking to stay abreast of the next technique or restorative material or device that's on the market to provide even better patient care. Now we need to look at safety wear for the best level and next level of safety protection. Thank you so much.
Dr. Arsenault, our diva Mary isn't with us today, but she wanted to ask you about the shortcoming of the OSHA standard. What problems or solutions would you offer?
So that's a great question. In terms of the shortcomings, right now, I would say the greatest shortcoming is this awareness. So I'd like to go back to you folks, and I was really excited that you wanted to talk about this because I think by us meeting and bringing about this awareness is addressing a shortcoming, because my biggest stumbling block, if you will, was the fact that we've had a difficult time getting the word out. It would be very sad to see if, say, for example, an employee is injured because there wasn't an awareness. And in a liability case, followed as a result. That would be very, very unfortunate. So by us gathering and disseminating this information and sharing it, hopefully people will hear this and learn what is appropriate. So I think one of the greatest shortcomings, if you want to be direct, is that I don't see OSHA actually marketing this or communicating this new appropriate level of eye and face protection. It's up to us in academics to do so. So, I would love it if OSHA sent out sort of informational risk blurbs or new and improved things that we should be looking for. But, in their defense, they're probably such a large body. And not only do they look at, dental health care providers, they're looking across all occupational industries. So that may be a lot to ask for, but so you essentially have to look for the information. So that would be the shortcoming, I think.
Well, that's pretty important then to get this message out about appropriate protective eyewear. I know I mention it in all of my lectures, and what I'd like to do is turn the microphone over to Olivia, who is our legal eagle. She's an attorney, and she absolutely understands every bit of what you had said about the liability part. So, Olivia, you had more questions.
Yeah, well, first of all, Dr. Arsenault, I think this is very educational, and I hope that our listeners take advantage of not only listening to this, but presenting this information to their teams. What I have found, I'm in my 25th year of consulting, that when we do on-site audits, hands down, every location we've ever audited has failed on eye safety. We may have majority wearing appropriate PPE, but there are always infractions that we note related to eye safety. Either they're not wearing safety glasses at all, or they're wearing prescription glasses, and I'm very concerned about it. We've been following your information for years, very passionate about it. All the work that you've done in improving for bottom safety of the glasses is incredible. So I just want to tell you how much we appreciate that. This number is staggering. 70% of the dentists had ocular trauma. That's incredible. But I do want to find out a little more about what would be the most up-to-date standard of care regarding eye safety in dentistry and bloodborne pathogen and debris protection. What are your thoughts on that?
Thanks, Olivia. I appreciate your support and interest. So having the new standard established, it sets a benchmark and a reference point as to what we as healthcare providers have to address. So we kind of look at it with an engineering mindset, and we look at a problem, identify the problem, and we need to find a solution. So what all the research has ultimately led to is the fact that, and this is the problem, that the combination of a mask, a regular flat mask, cone mask, N95 mask, whatever mask you choose to wear, and the protective eyewear is not in compliance with OSHA 1910.133. And the reason is that this combination would not prevent reasonably foreseeable debris from reaching the practitioner's eyes through the said bottom gaps. And so that's sort of the gist of the problem. So with the problem, we need a solution. And this is what the research has found, that the solution is to very simply close the gap, close the bottom gap. Just like side shields are a standard, now bottom shields are a standard. And that's all we have to think of it. So now the next question is, what's the current technology on the market available? And so back up for 1 second. Whenever, the beauty about American innovation is that, and how this country has grown to be what it is today, is that when problems arise, we find solutions, and that is what's called innovation. Just for example, when automobiles were first invented, they didn't have seatbelts. Okay, and people were getting into accidents, and then somebody invented something called a seatbelt, and they found that the seatbelts greatly reduced fatalities. So that became the standard. Now, the same analogy applies to bottom gaps. We're finding that, hey, there's a large majority of providers in the healthcare field that receive some degree of ocular trauma through bottom gaps. We have evidence-based research. We have a new standard. And so now we have seatbelts for the eyes, and that's called bottom gap protection. So the current technology, there's masks with face shields that come up from the mask. There's visors. There are varying products that address bottom gap protection. And getting back to the innovation piece is when you see a problem, it allows and lets our minds invent and develop better products. And so there are products out there that offer bottom gap protection that are evolving and hitting the market and allowing comfortable compliance. That's the key. So you have to find protection that's comfortable and that meets the provider's needs. And so innovation is occurring as we speak. New products are hitting the market. And that's how we're addressing the sort of shortcomings of the problem.
It's interesting. And I like the way you mentioned about, wish OSHA was more involved. And to build on that, I wish the dental boards were more involved, because it'd be so specific to dentistry. It seems like that might help too. But your research is amazing, and I hope our listeners will take notes. Back to you, Leslie.
Thanks, Olivia. So, Dr. Arsenault, what are your understood conclusions, if you can offer those? And then let's say if there's any other closing thoughts that we have surrounding eye safety.
Great. So I think, in summary, prior to the new Z87.62 standard, the only standard we had was, and these numbers are just, they're hard to wrap your head around, it was called Z87.1. And bloodborne pathogens were not addressed in Z87.1. All they looked at were impact resistance to the eyewear. And quite truthfully, in the healthcare field, that's a sin because we're dealing with bloodborne pathogens all day long. So, the new standard came about, Z87.62, addresses bloodborne pathogens. It focuses on bottom gaps. It elevates our standard. And, I look back and we always think in life, what have we done? And so one day when I'm long gone, my hope is that maybe because of this, maybe I saved someone's eyes and their vision and their career. And so I think, doing things like this could be considered monumental. It's, Z87.62 now. It's incorporated into the OSHA standard for what's appropriate. I think we've changed the game. It's a game changer. And I'm so thrilled that we're bringing this out. The other point I didn't mention in my words were the American Dental Association became aware of this new standard Z87.62, and they did what's known as a direct adopt of this standard. So now it's an ADA standard. And so with that, the thing that I'm really excited about is when CODA accredits dental schools, they follow the ADA standards. So now all dental schools need to stay in step with this new ANSI Z87.62 standard. And it's quite interesting. In one of my presentations, I outlined a story, and I put in a story from a dental student, and he was a newly married student. He was wearing all the appropriate eye and face protection. He was working on an HIV positive patient, and some of the bloodborne pathogens came up through somewhere into his eyes. We found out later it was the bottom gaps. But this young man, being newly married, put a great strain on their brand new relationship. He had to go on a whole cocktail of medicine, and his wife actually wanted him to leave the dental profession because she felt very vulnerable and afraid. And so that was a very incredible, stressful time for this young man. He actually was so stressed out, he failed a couple of his dental school exams as a result. And he was at a crossroads, and he almost left the profession. And he was a senior dental student. So I think in summary, the new standard is going to prevent a lot of exposures. It's going to, help people. It's going to preserve and it just upped the game in terms of what's appropriate for eye and face protection.
Well, thank you so much for that wonderful wrap up and conclusions. I know for the Compliance Divas, we will do our very best to push your message out to all of our listeners on the podcasts and also to our own clients. I'm very tempted to send out a newsletter today with information about this podcast and how important it is to pay close attention to this next level of eye care and the bottom gap. And hopefully we can save people's eyes from injury. I know that when you lose eyesight in one eye, your depth perception is off. So that's certainly going to make a huge impact on a practitioner's ability to deliver safe care.
That's awesome. And I think that's great. The interesting, we don't want it to end just with the providers, because as a provider, our responsibility is also to take care of patients. And so now we just recently, and it came out this month in the Massachusetts Dental Society Journal, we published research looking at patient eye safety. And interesting, because it's not, they're not an employee, they're not covered under OSHA. It's not an occupational safety. So OSHA doesn't mandate any protective eyewear for patients. The CDC recommends it, and dentists should be complying to that, but there's no mandate. So we just have some fresh off the press research, and we did spray studies looking at the patient's eye, and bottom gaps are an issue for patients as well. So if anybody wants to look at the Journal of the Massachusetts Dental Society fall, we're also looking at patients, because as healthcare providers, we're not only responsible for ourselves or our employees, but also, of course, the patient.
Well, that's great information to remind everyone. Don't let our patients backpedal on that protective eyewear that we offer them. And if we're not offering it, we should be. Dr. Arsenault, thank you so much for joining us today. the Compliance Divas podcast, and we all want to remind our listeners that we bring clarity and simplicity to compliance by navigating regulations to keep you on course. Please submit your questions to support@thecompliancedivas.com and look for the resources that were mentioned today in our show notes. We would love it if you would leave us a review, and of course, anything you want to mention about Dr. Arsenault, we'll pass it along to him as well. Thanks for joining us, and that's it till next time.